Hello everyone, it's Abrilia and welcome back to my channel, Health Insurance in Africa for Expats and Visitors. First, private healthcare in Southern Africa or South Africa and Zimbabwe. South Africa is a regional hub for private healthcare. Many people from adjoining countries are flown in to access their higher and private health facilities. It is therefore safe to say that South Africa is a reliable destination when it comes to access to health. Although only about 16% of the population use modern private facilities, over 75% of doctors in the country are private practitioners. Being a very popular destination in the expat world, South Africa delivers when it comes to meeting the health and safety standard of the world's most advanced nations. It's worth mentioning that the majority of the country's 55 million people rely on the public health service. It can therefore be expected that local state-run clinics or hospitals are constantly overwhelmed. The country also has a very low doctor-to-patient ratio. For expatriates, this means avoiding the local experience altogether. And then Zimbabwe is one of South Africa's neighbors who rely on the latter for advanced medicine. It's therefore noted that international citizens wanting more modern health services need to fly out to large cities such as Cape Town or Durban for their medical interventions. Zimbabwe being economically poorer, this is visible in the level of healthcare development. Expats will find most of the state medical installations wanting. Solid, comprehensive health insurance is thus advised. Those moving to Zimbabwe should also bear in mind the need to pay in advance before any treatment, so it's crucial to plan cash flow accordingly. And then number 2 is option for national health insurance in West Africa, Nigeria and Ghana. Nigeria has a national insurance system for its public health service. This doesn't, however, resolve the country's rather poor medical infrastructure that the private healthcare system is existent but specific to big cities. The country, moreover, has diseases such as tetanus or cholera, which are still fatal there. As opposed to other more developed countries, it is therefore strongly recommended to have a robust and inclusive insurance plans before moving to Nigeria. Your plan should be able to cover evacuation to another country for treatment, as well as repatriation in case of grave illness or death. And the neighboring Ghana has a national health insurance scheme as well. Expats can have access to it for an additional fee. However, with medical resources in the country pretty thin, it's best for foreigners to have an all-inclusive premium. Moreover, malaria and polio are among the diseases that remain prevalent in the West African nation. It's worth seeking medical advice before moving to Ghana for vaccinations and other preventing care. And then number 3, health insurance in East Africa is Kenya. The public health system in Kenya is funded by an insurance scheme. Also, the facilities available depend on the region which you are in. Expect the standard in the treatment and hygiene to be below par. This is why expatriates prefer to use private medical practitioners. They are generally of higher standard both in terms of facilities but also hygiene. And the number 4 is North Africa's health insurance options in Morocco and Egypt. Morocco, like many other African nations, also relies on an insurance scheme to fuel its public hospitals and clinics. As a developing country, these are well below first world quality. It's therefore natural for international citizens to prefer the private sector for medical needs. However, insurance is a must as private health services are exceptionally expensive in the country. And then Egypt doesn't fare better in comparison. It's even recommended to consider all major treatment or operation outside of the country. Expats who plan to move to Egypt would thus be well advised to choose an insurance plan that covers evacuation and repatriations. Also, there are many foreign doctors in the Egyptian private healthcare. It's best to seek recommendation from fellow foreigners for the best hospitals and clinics. So that's all for today. Don't forget to like, comment, and subscribe this channel. See you in the next video and bye bye.